Why do you think it is important for the faith community to be part of this conference today?
You know, the faith community is a real important community. Myself, being raised with a minister, I value the partnership. There's nothing like the spiritual and the faith-based community to outreach to community members. A lot of times, we find that residents are a little worried of that white coat syndrome when they go to their doctor or their nurse practitioner. If they have that relationship with their parishioner or a member of the church, it provides a nice entree. Or not everybody belongs perhaps to a church, but the church is in a community, and communities are very diverse. And the church is a safe place, so a really invaluable, priceless partnership.
What is the state currently providing that you think more constituents should be made aware of?
You know, the state has a lot of great resources. I would encourage the community to be aware of that. In Delaware, if they're wanting to know where state services are, they can actually just pick the phone up and dial 211. Now, as far as services are concerned, I'm biased because I'm a public health nurse. We provide a lot of services for treatment once a problem has occurred. So once somebody has cancer, when somebody's had a stroke, once a problem's occurred. One area I'd like to continue to work with our Secretary of Health, our Governor Carney, and Dr. Rattay in public health is prevention. And many of the churches and nonprofit community groups are aware of that, and having education. The other thing is to our families in need, those with mental health, substance abuse, or if they have family members that have cognitive dementia and Alzheimer's issues, because that is a growing concern. We want to make sure that people know who to call, what resources to go to. And so that's an area I think we'll continue to work on.
What is Delaware doing in healthcare that other states can learn from?
You know, Delaware is a microcosm of our country. As a professor at the University of Delaware in nursing and public policy, you know, we use Delaware because of our composition, our racial composition, our gender, and we reflect across the country. One of the things I'm most proud of is chair of the governor's consortium, cancer consortium. Bill Bowser's championed this years ago, and he passed the baton to me and Dr. Patricia Hogue. We've been a role model for the state, and it's not been me, it's been the fabulous physicians, nurses, community members, nonprofits who really role modeled how to lower cancer discrepancy. Racial barriers are huge in the cancer area. We have eliminated the discrepancy of colorectal cancer in the state, which is huge. Now that's one example. I could go on and talk about HIV/AIDS. I could talk about infant mortality, good and bad. I could talk about some of our leadership in the areas of occupational health and employers. There's lots to be done. I'm very proud, but I think the cancer is a highlight where when good-minded people get together with governors, with policymakers, that things can really change, and you do move the needle.
Thank you.
All right, thank you.